Hello, everyone. It's another day with your fertility specialist. I'm the host for this session today, Ruth Ogogo. On behalf of Alps Hospitals, I welcome you to another interesting session today. Today, we're talking about laser technology in gynecology. Would love to say thank you, dear viewers, for always liking our post, for sharing, for always linking to your screen. It's good to have you. And it's really amazing sometimes when we get to meet some of you in person and we say, oh, I've been watching. So we hope to see more of you watching and eventually getting to see you in person. Very glad to see you. Today we're talking about, like I said, laser gynecological laser technology in gynecology. And to talk about this today, we have a special guest. Yes, I'm sure that some of us have been wanting to see his face. Yeah, he's here for us today. In person of Dr. Kenneth Eguda. Dr. Ken, it's good to have you with us today. Welcome after a little break from here. So, maybe it's about Dr. Ken. Like we talked about laser, so I will tell you a bit about Dr. Ken regarding laser. It means that you are seeing a laser representative right now. He's a consultant gynecologist, he's a minimal access surgeon. And so I will talk a bit here. Minimal access surgeon, one of the best you could ever think of. As a matter of fact, he pioneered laser gynecology in Africa. So it means talking about laser technology today, you couldn't have had anyone better than Dr. Ken talk about it today. Please call up someone right now because you don't want to miss the session today. As many people as you can call up for this session, share this link. If you need to send data to someone to get connected right now, please do so. Share as much as you can because there's just a lot. You see what I'm emphasizing? There's a lot that I want to talk about today. Drop your thoughts, your comments, your questions in the comment section and we'll respond to them appropriately. Dr. Ken, once again, is should we say it's good to have one of the laser machines because it's good to have you with us today, Dr. Ken. So I'm wondering, someone might just be thinking, what's even this laser they are even talking about to begin with? Because I'm sure some people might have heard of that word laser. So now we're now narrowing it down to gynecology. What do we even mean laser? Introducing laser technology to gynecology.
Oh yeah, thanks Ruth for the kind introduction.
Better.
There's a laser that has been actually invoked for a while. That's the CO2 laser, the carbon dioxide laser.
Mm.
You know, that's used for some time to do some procedures like to burn endometriotic deposits. I mean, women that have endometriosis, that's been used for them some time. And CO2 laser, and in some part of the world, the CO2, the carbon dioxide CO2, it's used for vaginal rejuvenation. But the problem with that laser is that sometimes it's usually hit out of control, you know. But now, the laser we're talking about that relates to me, that I think I primarily use in Africa, in gynecological surgeries, is a diode laser. It's a diode laser. You know, it's one of the most intelligent form of energy. One of the safest form of energy is to use in operation. Any form of gynecological operation, you know, it could be used for orthopedic surgeries. We use for general surgeries, dental surgeries, even for physiotherapies. That depends on how the material you use can be applied. So it's very versatile. It's very safe. Very, I use the word very intelligent. Yeah, with less or little or no complication if it is used in the hand of an expert. You know, the complication profile is very minimal. And for gynecological surgery, especially like when you're operating in the uterine cavity, it actually helps to preserve the health
Wow.
of the reproductive organs.
Yeah.
So that's it. So laser is a kind of light. This one is a light. The
Oh.
diode laser is a
Yeah.
light. Is a light that is used to carry out surgeries. The light is a form of energy. It can burn. It can cut.
Wow.
It can make structures you don't like to get vaporized. Call them to melt them, to
Yeah.
myelize them.
Yeah.
And it could activate other structure depending on the frequency that you're using. If it works according to the frequency. So it does all these kinds of things.
Wow.
And then it preserves the structures as you're cutting, and it doesn't spread the energy to damage the surrounding structures like other energies will do. So
Yeah.
that's a little about laser. So it's a form of light energy, very refined light energy.
Yeah.
Yeah, that finds application in different aspects of gynecological practice, since we are talking gynecology right
Okay.
now.
Okay. Viewers, hope we are noticing that. Hope we've been able to understand what laser, and it means that as we talk, you get to know that it's not it's not as hard as you feel like hearing the word laser. You think it's
You, you,
something.
you, you sorry. As conventional surgeons, when we
Yeah.
uh, the first of all, we train with blades, with scalpel and the blades.
Yeah.
So what we use in cutting through things is knife. You get it. Say, can you pass me the use it like you cut something, but this is quite interesting because in this, the light to the structure you want, just cuts it.
Looks like magic.
Exactly. And sometimes you touch gently and it cut smartly.
Wow.
So the blade of into electrical energy, the monopolars, the bipolars. But the challenges with those other form of energy that come in the form of scissors or even knife is that as they're cutting through a structure, they're damaging the surrounding area where you're cutting.
Okay.
Up to 2 to 5 millimeters lateral. I mean, away from where you're cutting.
Yeah.
So you could have so much problems, even though you're doing something good with the cutting. But laser, no, it just cuts and leaves every other surrounding structure healthy. So it's very useful because it preserves stuff as you're cutting. And you see, when you have bleeding, sometimes when you're operating, sometimes conventional surgery, you either sew the blood vessel, you suture the blood vessel. But with laser, you just point the light at the point bleeding and it just stops it.
Wow. Interesting.
So it cuts, it stops bleeding, and it seals blood vessels and makes them not to bleed.
Wow.
Yeah. There are other gadgets that do that though. You have the electrical energy, the diatomy machine. I don't know what other language to use for this, please. Diatomy monopolar. They also stop bleeding. In their own case, you use a pair of forceps to clamp on the bleeding structures or the bleeding vessels. So it just bonds the bleeding vessels and stop it from bleeding. And then it causes the surrounding damage that they can cause, stopping bleeding. But laser doesn't do all of that.
Wow.
So it's quite
interesting technology.
it's a pretty energy.
Oh yeah,
It's a pretty energy, yeah.
Oh yeah. So viewers,
And it gets even finer than that. I guess we get into that in a bit.
we'll get into that in a bit. And then viewers, it's good to know that talking about this is good to know that for us to get to this point of talking about laser gynecological procedures, it means there are things that you can actually access and you can have access to them at ALPS hospitals. And they actually, if yes, as much as Dr. Ken pioneered that in Africa, if there are centers that actually do, there are just a few, and ALPS hospitals happens to be one of its kind. Like when you have someone pioneer that, it means that you couldn't have had that's first-hand experience. You have first-hand experience with laser gynecological surgery as ALPS hospital. So it means we're talking about having the best of practice when it comes to laser gynecological surgery at ALPS hospital. So it means, please just hold on a bit, catch your breath a bit. There's more coming.
And that we're actually open to training of doctors.
Yeah.
There's quite a number of doctors, not too many anyway, a few who are interested in this kind of adventure in the use of energy, visits and find application of laser, not just for surgery, but for some other parts, other aspect of the health of the humans. Call it gynecological health, dental care, general surgical care. So you just find application of laser, and also we're open to training doctors who are interested.
I'm sure you've trained some.
Oh yeah, the few centers who practice laser in Nigeria, I think were all trained by me and my team. You know, when we returned from Europe with the laser technology, so we train quite a bit, and but some come physically for training, and all our gynecologists, in fact, with some of our nurses, could actually do a lot. They can build institution with lasers.
So it means that you so viewers, this is just as much as we act, no matter how we talk about this is just a fraction of what you'd actually experience.
The laser stuff is actually quite addictive, because before I went to the International School of Laser Gynaecology in the world, which is only one, by the way. All the surgeries were by use of the monopolar, bipolar sources of energies, and the forceps, the scissors. But as soon as you find yourself getting to use laser, you just find that it's very versatile, and you're tempted to use it for almost everything. And you get to a point that if you're not very careful, you dump every other thing just for the laser, because it is very easy. You can imagine just pointing this light at something, and it's already doing a work.
Exactly.
So it makes surgery a little faster, less complication, better healing, preserving structures, less adhesions. I think if Lisa is a human, she'll be falling in love with me right now.
So viewers, I'm sure that yes, you've heard a lot about what you can do, but now we're going to talk about its application now, to the specific ways that you actually apply laser to gynecology. From your experience over time, what are the various ways that you've actually had to employ this laser energy in your various procedures as a gynecologist?
Oh well, I think the most frequent is using it for the gynecological surgeries, for instance, hysteroscopy. Yeah, because it's seamless. You could use it for hysteroscopy, doing your fibroid surgeries. Hysteroscopically. We have uterine abnormalities sometimes, and that the uterus is divided into two by some fibrous structures. You could use the laser to cut through it, and then it unifies the uterus and makes the uterus healthy again. So we call that metroplasty, laser metroplasty. Sometimes women grow polyps in the uterine cavity or in the cervix. Laser can just take that out, and from our observation and from reports following studies, the rate of recurrence is very low, almost. Go through gummed to itself. The surfaces are attached for being complicated. Some procedures, laser can be used to fix all of that. So those are the things you could do hysteroscopically with laser. Then laparoscopically too, you could use laser to do myomectomy. Yes, to do myomectomy, even to do hysterectomy.
Wow.
Exactly, use it to do hysterectomy. You could use laser, because all it does, instead of cutting with scissors, touch it and it just cuts through. And as it's cutting through, it's sealing the blood vessels. You don't have any significant bleeding and all of that. So laser can be used for that laparoscopic gynecological procedures. But where you need to cut and you need to seal blood vessels, the laser can find its application around those areas. And of course, more importantly, when you're thinking of conserving the health or preserving the health of the reproductive organ, laser, it's the best energy to be considered if it finds application around the structure. So these are some of the stuff that laser can be used for. These in the surgery. But more importantly, when you want to avoid surgery, when you come to core gynecological practice, when you have post-delivery vaginal abnormalities, like vagina um, laxity,
Yeah.
pelvic floor laxity, stress urinary incontinence,
Okay.
you have a prolapse of the uterus, or anterior wall prolapse or posterior wall prolapse, and you
Perhaps.
have the bladder, pushing its way through the anterior wall of the vagina, what we call cystocele. It happens when women have multiple pregnancies. I mean,
Okay.
deliver multiple
Delivery.
times, whether by vaginal delivery
Or
or
cesarean
cesarean
section.
delivery. So you could have this bladder falling through into the vagina,
Vagina. Wow.
I mean, some pocket of
Of
it.
it.
You know, conventionally, surgery is done to send it back to where
Back.
it's coming from. We call it, you know,
Helps cystocele. I think
yes,
that's
cystocele. Yeah, you
to
have you
cyst.
have the rectocele, when
Yes,
the
the
rectum
part.
also pushes its way through the
Yes.
anterior, I mean posterior wall of the vagina. So you got all of those perioneraphy fixing the pelvic floor,
Flow.
you know. So you cut the surrounding structure, push back and suture, and these
Yeah.
surgeries can take like 2 hours sometimes to complete. And of course, it heals with scar. And then this basically surgery with of the health of the organs or the surrounding tissue. But you see, laser can fix all of this
Wow.
without even a cut. You know, because I know that I'm going to be talking about laser, I came with some of my
Oh.
laser stuff. You see, for instance,
Yeah.
I watched the other series that I wasn't available.
Yeah.
Some other doctors talked about stress urinary incontinence, for
Incontinence.
instance. A
Yeah.
situation that happens when women are getting towards their menopausal period,
Yes.
or they've had so many deliveries,
Deliveries.
or a traumatic delivery that has compromised the health of the urethra. Compromise the pelvic floor, compromise the health of the urethra, so that when a woman coughs, for instance, urine may just escape.
Cells.
And then when she laughs uncontrollably, she may just
Have some
spot some
spores
urine.
of urine.
And if she's wearing very
White
white
clothing or
clothing, for
transparent
instance, then
clothing.
you could just see
The stain.
this stain of urine on the white clothing, front or back. And that can be very embarrassing.
Yeah.
So stress urinary incontinence, so this probe you're seeing, this one, just fix that,
Wow.
just like a child's play. So
Viewers, can you see that?
all you need, instead of, conventionally, that will be surgically corrected.
Yes.
You correct that surgically. But with this, it rejuvenates the urethra outlets,
Wow.
and try to fix back the anatomy and the physiology that was lost, making those abnormalities to happen.
Wow.
And it just takes like 10 minutes. And then you don't need anesthesia. All you just need is just connect it. This is the source connection. By the way, this is just the box.
Yeah.
Now, this is the connection to the laser device. She doesn't even need to change to surgical to
Outfits.
patient clothing.
Yeah.
If you want to be that fast.
Yeah.
And it can be done in the consulting room, not even in
Wow.
the operating room. That's how fine this works.
Wow.
So all you need to is connect it and choose your frequency.
Yeah.
Because some of the laser machines have two different frequencies, dual
Okay.
frequencies. So just
Yeah.
program the frequency if it's not yet programmed for you.
Yeah. Yeah.
Then you have a light at the tip of the laser, and you just put it around there and move it around there just for a bit, just for 5 to 10 minutes.
Wow.
And that abnormality gets corrected.
Corrected.
And then she may just need a renew. A follow up at intervals to just keep it in place.
Yeah.
Because you see, women are always scared of surgeries,
That's true.
and that should be a small surgeries, anyways. But then this does without surgery, no anesthesia,
Exactly.
and then it also rejuvenates all the other aspects of the vagina, because the urethra just comes out through the vagina, and then if it's post delivery vaginal laxity, for instance, this is now the cap for it. This is it.
Yeah.
And then you can just put it in the vagina. This is after preparer period, 6 weeks. I think preparer period is 6 weeks.
Yeah.
Sorry, I haven't practiced those those delivery things in a while. So yeah, this just does the work. So this tightens the vagina again
Wow.
without necessary cut. Before now, when women's vagina is lax,
Yeah.
loose, and the partners complain that this is so loose, they don't feel anything. And this usually happens following multiple deliveries,
Yeah.
or menopausal changes.
Yes.
Usually the gynecologist will cut the skin and the
Reduce.
wall of the vagina and tighten it. It's just like you're wearing an oversized clothing and then somebody trims it to your
Yes.
size. So
Exactly.
it's trimmed and then sutured. When you trim and suture, yes, you achieve some reduction in the caliber of the vagina, but then it heals with a scar.
It's true.
And that scar that you have there could actually make sexual intercourse a bit painful. It doesn't solve the problem of the dryness that comes with aging and menopause.
True.
And it doesn't help to get back lubrication. But then with this,
Yes.
it reduces the caliber without cutting.
Wow.
It tones the vagina, tones the vagina wall, and helps with lubrication because it activates the glands in the vagina.
Yeah.
And then the woman gets wet so easily now.
Yeah.
And then there's no cuts. So there is no healing with scarring and pain subsequently.
Yeah.
And it restores the health of the vagina. So that's how this does, and it's just a 10 to 15 minutes procedure.
Wow.
So now recommended for women who have had vaginal deliveries, even if it's just one vaginal delivery, they could have it after the period that is considered safe, and those who are having menopausal vaginal changes. And these changes may just not be laxity, it may just be painful intercourse because of the thinness of the vaginal wall. So this helps in helping the vaginal wall to be robust again. It helps glandular formation.
Yeah.
It helps deposition of collagen. Collagen is what causes a stretch, elasticity.
Yeah.
Then it causes formation of new blood vessels. Can you just imagine?
Wow.
So it actually
Impressive.
just works just like witchcraft.
It's okay.
Medicine in Africa. All right, maybe the better word is magic.
Okay, yes, let's speak magic.
Magic is better. Okay, it was like magic, or rather, it's very versatile.
Yeah, yeah.
So it causes deposition of collagen, formation of new blood vessels, improvement of activation of the glands in the vaginal wall. So this brings lubrication, brings elasticity, and improves pleasure.
Wow.
And injuries or easily bruising that happens with thinness and aging of the vaginal wall gets better with this. And it's just 10 to 15 minutes. The surgery lasts 2 hours, for instance.
Exactly.
Then you have anesthesia. Then it takes like weeks to heal.
Yeah.
And after it takes weeks to, I don't know how long it takes some people to resume sexual intercourse. Maybe a month or two. But for this, if you're going to stay off sexual activities, maybe 3 days max, and then you get back. No surgeries,
Exactly.
no time off work,
Yeah.
no taking off holidays from anything, and then life continues. So that's how this works. That's how this works. And this is, by the way, recommended for women undergoing menopausal vaginal changes. Women complain a lot to gynecologists. They don't complain even to their partners, but the gynecologists get to find out.
Yes.
And then some who have traditional way of dealing with it do the traditional things they need to do, like a steaming with concoction and herbs, and sometimes they come with accident to the hospital, because sometimes they put potash. I don't know what potash is called now. What's just called potash?
Potash.
And it causes all this damage. But this is clean, and doesn't cause any injury. The only discomfort you may feel is just maybe the warmth. And the warmth is usually between 40 to 45 degrees Celsius. And then it is compatible with the skin, especially with tender skin like the skin in the vagina and all of that. So this does all of that. And more importantly, it helps in restoring the health of the microorganisms in this place.
Wow.
And
That's
sometimes
impressive.
difficult infections recurrent vaginal infection,
Yeah.
candidiasis, find solution with the application of laser.
Laser
You
vagina.
understand? So I don't know how that really happens, but it happens and it's used for that.
Wow.
You know. So yeah, these are some of
So
the things that
much
this laser
for
does.
laser
You know.
technology.
So I think if a woman has any health challenges with respect to reproductive organ that has to do with childbirth, prolapse, some degree of prolapse. By the way, some degree of prolapse can only be cured by surgery. But even
Surgery.
after doing the surgeries, you need laser to bring life back to those areas
Yeah,
because
it's
surgery
true.
only is mechanical.
It's
Laser is both
true.
mechanical in function and
And
physiological
physiological.
in function. So it restores the physical anatomy and the function of the space you operate in. So I talk about laser,
This
then this
is
is what diode laser
laser.
does. Not carbon
Wow.
dioxide laser, diode laser.
So viewers, this is so much for a technology. I mean, this is something that everybody should embrace. When you hear magic, like all these things Dr. Ken has mentioned, I'm sure that with experience over time, he has had clients, or at Alps hospitals, we have had a lot of clients that have actually gone through this procedure, and they are doing very well with it, and they keep referring their friends to come and have that experience. So what's stopping you from actually coming to have that experience so you can actually restore your confidence, restore your self-esteem, restore the overall health of the vagina, of the pelvic floor, just to have some comfort, at least, even not for anything, for your own comfort as a woman, is worth embracing. So much benefits.
Yes, that's not all, by the way. I'm not a plastic surgeon. Yeah. So we have plastic surgeons working with us, and laser is used for liposuction. Liposuction probes are different. There are electrical liposuction probes that use the diatomy and all of that,
Yeah.
to burn down the fat and then to suck up the fat.
Yeah.
So in apps, we also do liposuction, and the liposuction is done with the laser, and it heals faster, safer, and all of that. So you can see plastic surgeons finding even applications with the laser. So I guess when the plastic surgeons sit on set with me one day,
Yeah.
we can talk about liposuction using the laser.
Laser.
And then the skin lesions, for instance, that women could have. You could use the laser in the form of a pen, which is also all part of this, because I say it's very versatile. You can take out the lesion without leaving so much scar on the skin of the woman or the individual. So it does a lot. Then those who have warts, for instance, vulva warts or perineal warts, call it in a man or a woman. Laser takes care of that, and you don't want to know what the skin turns to be like.
Afterwards.
Tender like a baby.
Wow.
Yeah, sometimes without scar, as against using the podophyllene gel or cream that is very painful, that you need anesthesia sometimes to survive the pain. Yeah, laser does all of that.
Wow.
So it's a very dynamic, versatile, and easy to apply energy. Yeah. So that's it. So this is all some of the things that laser actually does.
So viewers, you don't need me right now to even ask Dr. Ken of the advantage of this over others, because he has said a lot about it. So
and by
the
the way, I use all the
advantages
other energies, right?
are
I use all the
glaring.
other energies. I'm not marketing laser. I'm just saying the benefits.
Yeah.
I don't market. I'm not connected to any company, but of course, I just use the energy. And I've gotten them. That's my experience with them, and that's not my. I wonder when my boss talks about laser, then you wonder how it's going to sound like. Yes, I'm talking about the pioneer of laser gynecology in the world itself, Professor Sergio Haimovich.
Demigod of laser.
Yeah, of course, he is the god of laser. Definitely is the god of laser.
So viewers, so much about laser technology, and even its applications to gynecology. And so if you are still wondering why you should, I'm sure that your wonder has been attended to.
If I am a woman, if I was a woman, or I'm a woman, I don't know which one is correct now. And I give birth.
Yes.
You see the changes that women have during menopause is a cumulative event building up and leading to that. For instance, a woman gives birth, first time delivery through the vagina. A good number of times, the birth canal is expanded with a cord. what we call episiotomy. You have a lot of trauma, then it is fixed, Then you see the head of this baby, about 10 centimeters size head like this, going through a vaginal canal that is just like this, It tears its way through sometimes. And sometimes without cut, you could actually have very big lacerations or cuts, and then you fix it. The muscle fibers are damaged, they heal, they become scarred, and all of that. So I would have a session after delivery. One, because it helps the scars to heal without so much, the injuries to get healed without leaving scars behind.
Yeah.
So the anatomy is restored soon after delivery. So you are reducing the menopausal effects of these traumas later in life, because even the prolapse itself, the cystocele and the rectocele that happen, and even the descent of the uterus itself are all because of the weakness. So if you have a habit of attending to this weakness per time, maybe following delivery or yearly, you may be preventing those gross prolapse
That would happen
later, and also maintain the physiology and function of the reproductive organ or the sex organ. So it's been recommended that women after delivery, call it vaginal delivery or cesarean delivery, should have a session of laser vaginal rejuvenation.
Wow.
Then when they are getting to menopause, they need sessions of laser vaginal rejuvenation. It's not for intercourse, it's just for the health of that place.
It's true.
The tensile strength of the vagina, the tone of the pelvic floor, the urinary, the bladder health, the infection prevention or control, and just general well-being.
Yeah,
that's it. So women have a lot of indications why they need all of this.
Yes. So if once you're a woman, it means that you've somehow been implicated to get to do this.
You would have to. Yeah. And the fact that you tolerate yourself doesn't mean you don't need it.
That's true.
Yeah, that's true. The fact that you tolerate doesn't mean you don't really need it.
Yeah.
You understand? You just have to do it. People talk about Kegels exercise, which is good. It helps physical. But how about Kegels with laser? It just makes it even more interesting or makes it better.
Yes.
So that's it.
We've even had, if you're just a young lady watching and you feel like, okay, maybe it's for people that have given birth, we've actually had young ladies that have actually come to even assess this, even at our hospital. So it means it just depends on what you're experiencing, and you shouldn't just keep quiet and feel like it's normal. At least see a gynecologist, see us at our hospital. Let's even tell you that, okay, whatever it is you're experiencing is fine and you don't need or you need, and then better just stay back and assume that whatever it is you're experiencing is normal. So viewers, thank you so much. Dr. Ken, any last word for viewers regarding laser? I know we've talked a lot about the laser, but just one word from them, or just a sentence probably to wrap this up.
I think if a woman finds, or couples find out that they have a need for such an attention, they should seek the attention, and don't keep those problems to yourself. Just discuss with the gynecologist and get the help that is necessary. Yeah, I'm sure there are other technologies to make the vagina wall tighter, or to narrow the caliber, but we're just talking about laser at the moment. So take advantage
of it. Yes, take advantage of it, and don't just sit and assume that whatever it is you're going through is normal or it's the same. Please do not die in silence, or do not remain in silence. There's solution, and you can actually access
in the northern part of the country. Sorry, as you're rounding up, in the northern part of the country, you have a lot of, not just in the northern part of the country, all across the country, you have fistula centers. Yeah, where you have trained gynecologists fixing vesical vaginal fistula, VVF.
Yeah.
Now the fixing is never complete because it's just mechanical. Sometimes there is some tissues are devitalized, fixing them doesn't just make them okay because they are
True.
devitalized. So you need to
Yes.
rejuvenate those tissues
That's
because
true.
when continence is lost, these are the things that bring back the continence. So you need the
Continents.
physical therapy, which is a surgery. Then you need a laser rejuvenation in the areas, and usually you're talking about the vagina. So you need a laser rejuvenation to help the health of those tissues.
Mm.
It makes them grow better, stimulate the myocytes, the cells in the muscles, and make
Yeah.
them more active, and you get a better control when you have a fistula repair, in addition to physiotherapy using the laser rejuvenation modalities. So there's
Yeah.
just so much you can say about laser. I
Yeah.
know
So
in the north,
much.
for instance, those fistula centers are teeming with population of people who have had birth traumas following poorly managed vaginal delivery
Yeah.
or neglected labor that has caused so much damage.
Damage.
So after
Wow.
fixing the fistulas, they may need rejuvenation.
Damage.
Yes,
Wow.
so please.
So, viewers, this is so much with laser, and I'm sure that someone right here, I'm sure that you're ready. It's affordable, so it's something that you can actually access. You can have access to it at Alps Hospital, either in Abuja or in Jos. But be sure that you're going to get the best of the service that you can never imagine, because Alps, Abuja, and Jos, we have the laser demigods. So it means that you couldn't have gotten the best of service with respect to laser gynecology and other procedures that are being done currently at Alps with laser. You couldn't have gotten a better one than you have at Alps hospitals. So we look forward to seeing a lot of you that have watched. We look forward to seeing you in person, or we look forward to you telling your friends, sharing this video, or telling people about it so they are able to get the benefits that you've actually heard from this session today. It was a very, very insightful session with you, Dr. Ken.
Always,
A lot.
thank you.
Thank you, viewers, for staying tuned. We hope that you enjoy the rest of your weekend. For now, we'll say bye.